Hello everyone, I am Rinal Bharat, faculty of Manibabula Nursing College, Catheterization University. Today I am going to demonstrate procedure of urinary catheterization. Urinary elimination is a normal process whereby urine is expelled from the urinary bladder. Failure of urinary elimination requires manual intervention to drain urine from the bladder by inserting a catheter into the bladder using sterile technique. Definition: urinary catheterization is the introduction of a catheter into the urinary bladder through urethra using aseptic technique for the purpose of emptying the bladder. Related anatomy and physiology. The urinary bladder is a reservoir of urine. It lies in the pelvic cavity and its size and position vary depending on the amount of urine it contains. When distended, the bladder rises into the abdominal cavity. At urethral orifice, there is thickening of the smooth muscle layer, which act as a sphincter and control the passage of urine from the bladder into urethra. The internal sphincter is under autonomic nervous control. The external sphincter guards the external urethral orifice, which is under voluntary control. Maturation occurs when the muscular wall of the bladder contracts. There is reflex relaxation of internal sphincter and the voluntary relaxation of the external sphincter. Length of urethra varies in the female and male patients. Female urethra is 4.5 cm long and male is about 20 cm long. The male urethra is surrounded by the prostate gland at the neck of the bladder. Types of catheterization. First type is intermittent catheterization. It is the insertion and removal of a catheter several times a day to empty the bladder. Second type is indwelling catheterization. It is also known as Foley's catheter, is left inside the bladder to provide continuous urine drainage. Third type is suprapubic catheterization. It refers to the placement of a drainage tube into the urinary bladder through a surgical incision made in the abdominal wall just above the pubic symphysis. Purposes. Purposes for intermittent catheterization are to relieve bladder distension, to assess for residual urine after voiding, to obtain a sterile specimen, to empty bladder prior to delivery or abdominal surgery. Next, purposes for indwelling catheterization are to facilitate urine elimination in incontinent patients, to facilitate continuous bladder drainage after injury, surgery on urinary tract or other major surgeries, to spleen to urethra to promote healing after urological surgery, to relieve acute or chronic urinary retention, to prevent urine from contacting an incision after perineal surgery. Indication of catheterization. First, acute retention of urine in male patients with prostatic enlargement. Then chronic retention of urine. Then comatose patients, neurogenic bladder, hypotonic bladder and spinal cord injury. Then incontinence of urine. Before surgical intervention of pelvic organ. Acute retention of urine and investigative purpose. Scientific principles. During urinary catheterization procedure, we have to follow some scientific principles, which are first, principle of anatomy and physiology, principle of microbiology, principle of physics, principle of chemistry, principle of psychology, principle of economy, and principle of safety and security. First, we will see principle of anatomy and physiology. Micturition occurs when the muscular wall of the bladder contracts and there is relaxation of internal sphincter and voluntary opening of external sphincter. Temporary, in patient, normal function of sphincter is lost due to catheterization. So bladder training should be given to patient before removing catheter. Second principle is principle of microbiology. Bladder is the sterile organ. Thus, this procedure is also performed by using strict sterile method to prevent urinary tract infection. Double touch technique also should be used during insertion of catheter to prevent the infection. Third